Hey you guys, welcome to Lecture 30. I hope you're staying in, staying well, and staying busy. We'll spend most of today talking about the prefrontal cortex. And so keywords associated with the prefrontal cortex is planning. Planning complex cognitive behavior, also personality expression, decision making, and goal-directed behavior. And as with many things in neuroscience and neurophysiology, a lot of what we know about the prefrontal cortex we learn by what happens when there's damage. And so last time we talked about patient HM, and you've also likely along the way heard of Phineas Gage. And so Phineas Gage suffered an injury to his prefrontal cortex, and it had dramatic effects on his personality and behavior. So we'll talk a little bit about Phineas Gage later in lecture. So I've pulled most of this from a psych textbook, so I've given you the reference to it. I don't think you'll need to go to this textbook. Just use what I've put in the lecture slides. But if you, some of you in the BNS program may be familiar with this text, but in any case, this is where much of the information for this particular lecture is coming from, as opposed to Byrne and Levy or Boron and Volpe. We'll start off with basic anatomy, and we'll talk about association cortex. So a lot of regions of the brain have functional categorization. So there's the striate cortex or the visual cortex, there's the motor cortex or the sensory cortex, and then there's a lot of other regions of the brain that function as association cortices, which kind of integrate information across different modalities. So integrating maybe the sound of a dog barking with your knowledge, your pre-existing knowledge of what a dog is, and maybe seeing a picture of a dog like it's shown down here on the cover of a textbook. So that's an example of what association cortex or association cortices do. They interact with one another, integrate information across modalities, and produce higher brain function, complex cognitive processes, and working memory. And we'll spend some time today talking about working memory. And then I'll show you a little video, or I will ask you to watch a video on hot and cold executive function. But you might know somebody who's a little hot-headed, and you might know somebody who always manages to be cool as a cucumber. And so the most commonly used term for the processes that occur in the prefrontal cortex are executive function. So you can think of this as an overall kind of CEO of the brain, if you will. And there can be hot and there can be cold executive function, which will determine how, among other things, how somebody will react in a given scenario. And I'll show you a video to help clarify that in a little more detail. And then we'll talk about pathophysiology associated with Phineas Gage. And you may not know that with time, the symptomology that is often cited in textbooks in gross changes to his overall personality, they did dissipate over time, which again highlights a recurring theme in this course, which is plasticity. And then symptomology that you could expect to see if different regions of the prefrontal cortex were damaged. So that's our general trajectory and things that you want to be able to do once you've worked your way through this lecture. So I don't want you to worry too much about the anatomy. I would just like you to know where the prefrontal cortex is, right? So the most anterior region of the frontal cortex. And I'd like you to know that it can be subdivided in different ways depending on which textbook you look at, but certainly the dorsolateral prefrontal cortex and the ventrolateral prefrontal cortex. And we'll talk a little bit about damage to each of those regions, which would result in different types of symptomology. You don't need to worry about these other regions, and there's also orbital and rostral terminology. The medial prefrontal cortex don't worry about it. We're going to focus on the dorsolateral and ventrolateral prefrontal cortex. So I'd like you to take away that those are two key areas of the prefrontal cortex and the ones that we will focus on. Okay. Keywords: working memory and cognitive control, executive function, planning, goal-directed behavior, and personality are all things that we're talking about when we're considering the prefrontal cortex. So about a third of the cerebral cortex is the prefrontal cortex. So this is a substantially large anatomical region of the brain. Damage results in impairments to higher brain function, like intellectual activity, and changes to personality, as was observed with Phineas Gage, and a loss of ability to plan and organize. I'll give you an example a little later in lecture. And don't forget your dorsal stream and ventral stream when we were talking about the visual system. So the dorsal stream and ventral stream have connections here as well. And again, don't worry about orbital, rostral, and medial, but do focus on the dorsolateral and ventrolateral prefrontal cortex. Okay, so 1/3 of the cortex is the prefrontal cortex. Again, don't worry about these sub-regions. I'm going to focus on dorsolateral and ventrolateral. A number of mental health conditions or disorders have been shown to involve a reduced volume of the prefrontal cortex. So there is physically less gray matter present in individuals with certain types of mental disorders. And also interconnections with other brain regions appear to be impacted in some types of mental health disorders. And so that shows the importance, again, of the prefrontal cortex. Individuals who are incarcerated, individuals that are sociopaths, and individuals who overuse or perhaps abuse cannabis have similar observations have been made. So experience, whether it's maybe even post-traumatic stress disorder, repeated stressors, incarceration, which I imagine would also be a stressor, seems to impact the anatomy of the prefrontal cortex. Drug use as well in the case of cannabis. A well-functioning prefrontal cortex allows an individual to not be a sociopath, which would involve things like the ability to feel guilty, the ability to feel remorse, to be empathetic, which are often characteristics or features that are absent in somebody, in an individual who is a sociopath. And it's widely believed in the neuroscience community that the prefrontal cortex and the size of the prefrontal cortex and the connections, right? We've been talking about localizationism and connectionism. Connections of the prefrontal cortex with other areas are directly related to sentience, so one's consciousness and awareness of oneself. And so you could certainly say that it's part of the brain that makes us human and makes us conscious, self-aware organisms. And it's possible that non-human primates have a level of sentience and consciousness that's perhaps not so different from our own. And I've listed more keywords here for you again. Function of the prefrontal cortex: organization, concentration, judgment. And I think I stressed last lecture that this region of the brain is not fully developed until adulthood. So perhaps you did something stupid when you were a teenager, that maybe you wouldn't make that same decision now. So it's okay to partially blame your underdeveloped prefrontal cortex. I think we can safely do that, at least to a degree. Decision making, reasoning, creativity, regulating your social behavior, right? There's things you do in public and there's things you don't do in public, and abstract thinking. So there's a number of different higher brain functions associated with the prefrontal cortex. And then for those of you in behavioral neuroscience, or maybe in other courses you've talked about cognitive behavioral therapy, or CBT, which I won't go into here, but for those of you in the behavioral neuroscience program, it's the PFC, the prefrontal cortex, that's most important in therapies like CBT.